Hello everyone. So today's lecture is about basic concepts of a pandemic. The real reason I'm doing this is because we're all witnessing a certain degree of irrational behavior around us. And that is happening not only among the community, but also, and probably more worryingly, among the healthcare workers. We can see there's a lot of anxiety out there, low to moderate degree of panic probably. So I feel that one way to overcome this fear, which is absolutely understood, is to try to understand what's going on here. And I think that hopefully by the end of this lecture, you'd have a better understanding of this whole process, and hopefully you'll feel a little better. Have a look at this video. Yeah, scary. Now, this is the growth of a colony of E. coli. As you see, the beginning is very slow, but then it rapidly increases in speed to a point where it covers the entire picture. Now, this is called exponential growth. And the textbook examples of an exponential growth in nature are bacterial growth and viral spread. In particular, the spread of a viral infection among a susceptible population. A susceptible population is a population that has no immunity to the virus and has no vaccines available. Now, the exponential growth is a mathematical function and can be described by a mathematical model. And there it is. The mathematical model of an exponential growth says that the number of elements, okay, let's take for example a viral infection, okay? So let's say the number of infected people on a given day are equal to the number of infected people of the previous day multiplied, added to themselves and multiplied by a factor. Okay, so this means that the people who are infected are them who infect other people, and these other people are the ones who infect other people. So it's a quantity that adds to itself and multiplies by a factor. So from the equation, you can factor the numbers out, and there, for example, the number of infection on a given day becomes the number of infection of the previous day multiplied by a factor that is more than 1. So let me try to explain that with an example. You'll understand it better. So the number of infection on a given day, let's say 10, okay, 10 as an example, and let's see how that plays out with the equation. So let's say 10 is the number of infection on a day, and we sum that to the number itself multiplied by a factor. So let's say, for example, 1.2. And we want to calculate the numbers of the following days. So let's do that. The first one is 10, we said. The following day it will be 22, then 48, 106, 234, etc., etc. Now, if you take these numbers and you place them on a graph, this is how the graph looks like. It's a typical graph of an exponential growth. So the problem with the graph here is that you don't really grasp how much this can go on. So you don't really have a feeling of the projections of this curve. A better way to have that is to transform the exponential curve into a logarithmic curve, where we change the y-axis here, and every step will be multiplied on the y-axis by a factor of 10. Okay. So the logistic curve, the exponential curve on a logarithmic scale becomes a straight line, basically. And if you then calculate the linear regression of this curve, you should be able to identify the trajectory. So this is useful because here you can understand the projection. Let's say, for example, that in this example, okay, you have an increase of magnitude of 10-fold in 7 days. Okay, from here to there, you would have an increase by a factor of 10 in 7 days. And then if you follow the curve, you would have an increase of another magnitude of 10 by a shorter period of time, etc., etc. Now, the linear regression helps you to average out those jumps from one magnitude to the other, and therefore you can establish an average amount of time by which you have a jump of a 10-fold magnitude. So let's say in this example, maybe every 5 or 6 days, let's call it a week, okay, just for simplicity. Let's say every week you have a jump of 10-folds. So this is interesting, and it is very useful because that really gives you an idea of the magnitude or the rapidity of growth of this kind of pattern. Because in 1 week you would increase from 100 to 1,000. In 2 weeks you would increase from 1,000 to 10,000 patients. We're talking patients here. 3 weeks you get to 100,000, and by a month you get to 1 million. Okay, so now you start to understand the significance of the mathematical function here, and the fact that the growth is very rapid. So we shouldn't really be surprised when we see a huge increase of numbers. It is mathematical and it is described by a function, so it is to be expected. Okay, so that is important. So everyone should be expecting an increase of numbers because it is mathematical and there's nothing you can do about it. So we were saying that's a mathematical function right here. And so we want to understand what is this k factor and how can we influence it. So in this mathematical model, the factor k is given by the probability of a transmission to be successful, and by the average of people that interact with the infected patient. So again, the factor k is dependent on the probability that the transmission results in an infection, and by the average number of people that interact, or susceptible people that interact with that infected patient. So that is why it is recommended to use measures of containment, and namely you want to wash your hands and don't touch your face, so that if there is a transmission of virus, then you reduce the probability of success of that transmission. And then you have to stop gathering and traveling and adopt social distancing to reduce the average number of people that you interact with. So these recommendations do not come from best practice. These recommendations come from a mathematical equation. So we need to follow these recommendations. We need to reduce the gathering and traveling and meetings, and we need to wash our hands and don't touch our face so that we are less exposed to a successful infection. So if we apply those measures, hopefully we should be able to contain the spread of disease and therefore reduce the speed of growth of this virus, and then level out the exponential curve. Because in nature, everything is tends to an end, and there is no exponential growth in nature, really. Everything is logistic. So this is a logistic curve, and the significance of this is that the first part of it mimics an exponential growth, but then you reach a point which is called inflection point, after which the growth decreases, slows down, and then the process stops. So if we manage to use containment measures in an effective way, we should be able then to reach this inflection point, after which we will witness a descent of the curve. So here, the concept of growth rate is the new cases on one day divided by the number of new cases of the previous day. So we're talking about new cases, not the total number of cases of one day divided by the total number of cases of the previous day. This is the new cases in one day divided by the new cases of the previous day. So if the growth rate is above 1, this means that we are in the exponential side of the curve. If the growth rate is below 1, this means that we have passed the inflection point and we should expect a resolution of the problem. A growth rate of 1 means that we are around the inflection point. Okay, so let's have a look at what's happening around the world. This is China, and as you can see, those are real numbers, by the way. Those are the real numbers of the infected people. And it's fascinating how nature follows mathematical functions, really. You can see this is a typical logistic curve. We have an increase and then an inflection point and a decrease of the rate of infection. Now, the Chinese were very, very effective in containing this disease. As you can see, they reached the inflection point within a month. And that is really impressive if you consider the number of infections. So you really have to hand it to them. They really managed it very, very effectively. Now, you can see a little jump here. This is just interesting to notice. The reason for this jump is that here they stopped diagnosing people with swabs because they ran out of swabs. So they started, or they didn't really have the time to do it. So they just did the CT scans and they diagnosed people with coronavirus just looking at the CT picture of ARDS or similar pictures that were correlated with the coronavirus infection. So from here, they started diagnosing the virus with the imaging, and then you have an increase of the numbers. But again, they really reached the inflection point like within 3 or 4 weeks. That's really impressive. Let's have a look at Italy. we are still in the ascending phase. We're still in the exponential part. Although now Italy is completely in lockdown, so hopefully, looking at the numbers and the predictions, I think that Italy will reach the inflection point, I think, within the next maybe few days. But so far, we're still in the ascending phase. Spain, still in the exponential phase. France also very rapidly growing. I think that France is going to be a big problem in Europe because they did not contain until very recently. And there was a lot of movement. People were going around, gathering, partying and whatnot. And France really decided to stop all gatherings very, very recently. So I think we should expect a high number of infections in France in the following weeks. Germany also still in the ascending phase. That's the United States. As you see, the curve is very steep here. So the growth was very slow at the beginning and then an increase, massive peak. Now the reason for this is because they weren't testing. They weren't testing here because you have to imagine the curve was a little more predictable, like so. But here they weren't testing, and now they found themselves with huge numbers and a very, very rapidly increasing curve. So USA will be also another huge problem in the future. They will have huge numbers because they weren't testing and they weren't containing, and they're still not containing in certain areas. So the United States, I expect them to have huge problems in the coming weeks. This is Ireland, if you were wondering. As you can see here, we are at the beginning of the exponential phase. So again, it is to expected that we'll have an increase in numbers, and it bothers me when people, react with surprise on the new numbers every day, because again, it is a mathematical function. It is predictable and it is predicted. If you know the basics, you can expect an increase in the numbers, and you have to expect an increase in the numbers, and you have to prepare for that. So we're still at the beginning of the curve here. If you're wondering, the growth rate in Ireland, today is the 15th of March. We had 30 new cases so far, as I'm recording. Yesterday we had 20 new cases. If you divide, that was a mistake there. If you divide 39 by 20, it equals 1.95. So the growth rate in Ireland today is 1.95. It's quite high. So we're expecting, a lot of infections, a lot of cases in the coming weeks. We're still at the beginning of the exponential phase. And the other concern is that the containment efforts were probably not very strong, in that people are still gathering around the country, and so people were allowed to travel in Italy or other heavily affected countries until very recently. So really we should expect this curve to behave as a normal exponential curve. So we should expect high numbers in Ireland. Okay, basic reproductive number is another concept coming from epidemiology. This number is called R0, and is the average number of new cases generated by an existing case. And this is in a susceptible population. So again, susceptible population is a population that has no immunity and that has no vaccines for that disease. So R0 is the average number of new cases generated by an existing case in a susceptible population. So let's say I have an infected patient, an infected person. This person generates 2 or 3 or more existing 3 or 3 more new cases. So the R0 here is 3, okay, and by the way, the R0 of coronavirus is between 2 and 3. So these 3 people then become infected because they're susceptible, and therefore they will spread the disease to 3 or more people each. So you'd have 9 more people infected, and these 9 people become infected and spread to 3 more people each. So as you can see from here, it is easy to have an epidemic or a pandemic when the R0 is above 1, is more than 1. The R0 of coronavirus is between 2 and 3, so it's significant. R0 depends from the time during which the infected person is contagious, multiplied by the number of susceptible people that interact with the patient, multiplied by the probability or the transmissibility, which is the probability that the transmission becomes a new infection. So R0 is time by multiplied by the number, multiplied by the probability of infection. So if you want to decrease your R0, you want to decrease the time that the patient is contagious, and that is why we ask sick people to quarantine themselves, or we just quarantine them in hospital, because then we reduce the time where they can spread the disease around. So we contain the sick people by isolation. We have to decrease the people walking around and gathering. So we have to decrease the number of people interacting with each other. And we have to decrease the probability that a transmission results in an infection. And we do that by recommending washing hands and avoiding touching the face. Now, you might ask, why is this important? Why is it important to slow down the process? Slowing down the process, or slowing down the R0, is important because the healthcare system capacity is limited. We have a limited number of beds and a limited number of healthcare workers. And if you have a surge in the number of cases, then you'd have an overflow of patients in the healthcare system, and you have a huge strain on the system. This is important in this specific case of coronavirus because 10% of the infected people develop critical illness that requires intensive care admission. So 10% of the infected patients requires ICU admission, and the number of ICU beds across the country is very, very limited. So therefore, you reach your maximum capacity very, very shortly. So, and this is what happened in Italy. In Italy, you had a huge number of cases simultaneously, and a huge number of patients presented to the hospital with the sickness, with the disease, and then 10% of them ended up in the intensive care unit. So there was an overflow of patients in the units, and that had significant impact on the patient's outcomes. One way to avoid the surge of patients is to try to slow down the process. So that is why it's important to slow down the R0 and the transmission. So you want to contain with containment measures, so encouraging hand hygiene and avoiding touching the face and avoiding gatherings and avoiding and having the sick people staying isolated. Those containment measures help reduce the R0 and therefore help reduce the speed of growth or the growth rate of the number of sick patients. So you'd have something like so. You would still have a large number of patients infected, but you would have the number spread in time. So therefore, the healthcare system can respond and can accommodate the sick patients. So that is pretty much all. Thank you very much for listening. I know that it is not really a reassuring presentation, but it seems like we're a lot of bad news here. Bad news because we have a high growth rate in Ireland and because we have a limited capacity, especially of intensive care unit beds. So it could seem that we will have a significant strain on the system. But the good news, on the other hand, is that we are lucky in a way that there is a lag between the European country and this country. So therefore, we had the time to prepare. This is what we have been doing over the last few days. We were getting ready. We've increased capacity. We have opened beds. So hopefully by the next few days, we will have all details sorted. We will have all the processes reviewed. And so again, the good news is that we had the time to do so. So in conclusion, wash your hands and clean your smartphone. That's another thing. People don't realize that this virus can live on certain surfaces for several days, and it can survive on glass for a few days. So your smartphone is a problem because if you wash your hands and then if you touch your smartphone and then you wash your hands and then you touch your smartphone again and then you touch your eyes, then you still have a chance to infect through that, to get the infection. So remember to decontaminate your hands and your smartphone all the time. Don't touch your face and stop gathering. Stay at home if you feel sick and adopt social distancing. And more importantly, get ready. And that's what we're doing. So hopefully, I know this lecture was probably a bit sobering, but on the other hand, I think that if we know what's going on now, and that if we realize that we have the chance to be ready, then hopefully we will not see things that we have seen in other countries such as Italy. All right, so thank you very much for listening and see you next time.